Thank you, Mr. Chairman, and I agree with the senator from Montana. The vast majority of the VA personnel are doing a great job and working very, very hard. I think the thing that really shows that is just how few have actually accessed the program that we're trying to stand up so that they don't have to travel. You know, many of them are traveling even though they can stay home. But it's hard, and I understand the argument, and certainly I'm going to bring up an issue that was before your time. And yet it is hard in the sense that, you know, people are losing faith. Congress is losing faith. We have an issue in Little Rock. Congressman Hill has been looking into this very vigorously, where, you know, we have a situation in February of 2012, the VA received an $8 million grant to build a 1.8 megawatt solar panel system at the Veterans Hospital. In August of 2012, the VA approved a parking deck project, which was located in the same place as the solar panels. In January of 2013, construction on the solar panels began on the same location as the planned parking garage. VA officials were aware of the conflict at the time. In August of 2013, the solar panel construction is completed. In April of 2015, then the VA dismantles them to build the parking lot, and it's still not clear as to how much it's going to cost to put them back, and whether or not they were ever able to function in the grid to begin with. So I guess what I'd like is, you know, we've got these things going on. What are the safeguards that we've got? How are you dealing with this kind of stuff?
I mentioned some of the changes we've made to the process of construction in my comments. I also mentioned that we've changed the leader. We have a new leader named Greg Gibbons. He's got experience across many sectors of government and has done this before. I also happen to be an engineer. My certification is an engineer in training. I studied engineering at West Point. It's from the state of Pennsylvania. And our Deputy Secretary is a former CFO of a bank, very bright, intelligent guy. We're digging into this in the strongest possible way, and I would just simply say that's not going to happen. I mean, that happened in 2012. I appreciate you bringing it up, but that's not going to happen in the future. It's just not going to happen. What we're doing is we're having design committees. We're having outside people review our processes. We're using the Corps of Engineers. We're using the best practices that are available in industry today in order to make our system better.
I think one thing, though, that we have to be very careful of, that process, you know, started then, and yet I don't know how forthcoming VA was in admitting that the process was there. And even now, you know, when you ask how much is it going to cost to reinstall, we get terms like, I think, procurement sensitive or something like that. I mean, you know, which is just, you know, that's not appropriate.
I agree. We are trying to be more transparent and more communicative than ever before. And I would hope that since I became Secretary, you've seen an increase in my presence.
And I appreciate that.
And an increase in our transparency as a department. I still every day do catch instances where I wish we were more transparent and better about customer service.
The other thing I'd like to mention, and I want to compliment you in this regard, we had a group get together in Little Rock to discuss reimbursement to providers that have provided outside care. You'll have situations, you know, that arise in the VA where because of emergencies, or now with this 40-mile rule, that the VA owes them money. It appears that the VA owes lots of people in Arkansas a lot of money and has not been very forthcoming in paying those bills. That's a real concern, really, for a couple reasons, in the sense it's another thing that makes it such that the trust issue that we talk about. The other problem is, you know, if you don't pay your bills, they're going to quit dealing with you. And then that's the greatest thing, and that really is going to affect quality of care. Can you quickly mention that?
I will, and maybe I'll ask Carolyn to comment. I talked about our 5 strategies for my VA. One of them I talked about was improving our internal support services and going to a shared services model where we centralize the bill paying, so that's all the people do, is something that we're in the process of doing. We're not done yet. We still have more work to do, but that will dramatically improve the rates at which people get paid. Carolyn?
Yes, I would just add that we are tracking this rates of payments and how old the claims are on a weekly basis. And I am pleased to say that Vision 16, which had been struggling for a while, that's what Arkansas is part of, is actually improving faster than other networks, but we will keep a very close eye on it, because you said it well, Senator. If you don't pay your bills, people are going to say, gee, I'd love to help you, but I have to pay rent to veterans, and that's not going to work.
Thank you, Mr. Chairman. And again, your people were very helpful and did a good job in Arkansas. Thank you, Mr. Chairman.
Thank you, sir.